Hanita. Once again, I'm a consultant to Hanita Lenses, so I will just need to acknowledge that. And the intensity lens, this is a multifocal lens which should provide full range of vision lens. And it is designed by a very specific algorithm, which is called DLU, the Dynamic Light Utilization. And what it does, this is a computer algorithm in which the engineer defines how we would like the lens to look like and how we would like the light to be distributed and the different foci, which is all the secret of this lens. So what it does, it creates some kind of a profile, and if it is not good enough, it makes a second one. If not good enough, then it makes another one. So altogether, it was required to have 69 rounds of design, and this is the design of the lens. We can see there is a peripheral part, mid-periphery, and a central part of this lens design. And it is different than the other trifocal lenses. Most other diffractive lenses are the combination of two types of lenses. Those who provide distance and near and distance and intermediate. When you combine them together, then we have a lens which provides all three foci. Now this is a different design, and this different design actually provides more than these three foci. If this is the profile of the light distribution of the lens, so there is a far, intermediate, and near. But here between, unlike other lenses in which we can see a very deep, here at the center, here there is not a tip, but actually there are two additional foci, which makes the lens actually a pentafocal lens. And this is the light distribution. Actually, it has a far, intermediate, and near, but in addition to intensifier, is why it's called intensity of the lens, so it covers the entire range. Also, the light utilization is the data that comes from the companies. It's utilized light in trifocal lenses is usually between 86 to 88. The unused, the lost light is 12 to 14. And Hanita claims that used light is 93 and lost eye is 6.5. It doesn't seem smart, but it is one half of the other lenses. And this is one advantage, for example, but the difference between pentafocal and trifocal is that with trifocal, with these two dips, one can feel when it goes from one interface to the other. But with the pentafocal lens, it is flatter and higher, so it is more blended. We don't see the difference in between the foci, and it reduces the complication. So we did one study in my department. This is 20 eyes, 20 patients, 40 eyes, but these were the best case scenario. The lenses of normal patients, normal axial length, no astigmatism, no pathology, and this was the results. Distance, the average was 6.6, intermediate 7.5, near even better than 6.6. And here you can see the distance, 90% of the patient at 7.5, and intermediate 80% at 6.9, and the uncorrected, and near vision was 6.6 and better in all eyes. So this was really a very good result. This is the defocus curve, and we see that between 0 and 2.5, which is 40 centimeters, it is flat along the 6.6 line, as binocular is better than the binocular. But the more interesting is, what does the patient feel? This is a questionnaire, and they ask about glare and halos, and yes, they can mention glare and halos. Usually they mention glare and halos only if we ask them. They don't come with this complaint. And on a scale from 0 to 3, it was less than 1 in most patients, and most interestingly, when we ask them how are they function, and they say that they're driving and looking and cooking and looking at the traffic light and reading a newspaper and so on. In the scale of 0 to 4, it was almost 4 in all patients at all distances. But this was a study that for the company study in the very, very selected cases. So we did another study on my patient that I did 80 eyes of 54 patients of using this intensity lens, both hydrophilic and hydrophobic, toric and non-toric. So altogether it was 80 eyes. But most importantly, this is a real life patients. That is, every patient who desired to have a trifocal lens, and if it's something, or all of them, everybody has something. It could be dry eye or minor macular changes or controlled glaucoma and so on. We included them. As a result, we have that in 90% the uncorrected vision was 6.9, and intermediate, it was 90% 6.9 or better, and near 95% or 90% 6 J2 and better, meaning that they could drive, they could read letters. You see, unilateral without any addition. As for toric lenses, preoperatively range between 0.5 and 3, postoperatively 96% with 0.5 diopters and less. And this is hydrophobic lenses, pretty much the same, 89%, 90% 6.9, 100% 6.7.5, and 80% J2. So if we combine all of them together, which is 134 eyes, we see that if we the results are the 90% of 6.9, and if we take off all the cases which were borderline or some abnormalities, it goes even up to 95%. Now we look at the data from all over the world, and in Israel it was implanted only 30% of the lenses. Other we implanted in Latin America, in Europe, in Asia, also in this country, and several kinds of intensity lenses. Either it is open loop or 4 small loops or gray optic lenses. But again, all of them real life patients with some minor pathologies also included. And this as a result of a 6.9, 95% far, 98% intermediate, and 97% near, which is excellent. We can see the defocus between 0 and minus 2.5, almost as a 6.6 line, and the binocular a little bit better than the monocular, and all of them in between 6.6 and 6.9, the average. So now we look at the visual function, and again, glare and halos mentioned by some, mentioned but not complained, are less than 1 in a scale of 4 to 3. And as for the complaints or the function, the normal function, almost 4 out of 4. Satisfaction using spectacle independence, so it achieved the 95%. Having glare or halos, no was by 85 and almost none in additional 12. And you're happy with the results? Did you achieve the outcomes? Answer was yes in all of the cases. So just to conclude, this real life study did show that this lens or the pentafocal concept is effective for all distances. Very low rate of photic phenomenon complaints, and for me personally, this is a leading lens.